The primary healthcare team is in the middle of its weekly meeting to review new clients. The purpose of the meeting is to develop a plan of action for the clients. Present at the meeting are physiotherapist Andrea Gulliver, Nancy Furlong, the social worker, Kathy Kane, the family physician, Terry White, the registered nurse, and Simon Wilson, the pharmacist.
All right, our last clients are new. Mr. George Hong and his wife, Mrs. Lynn Hong. They were last seen by Nancy and Kathy. Who wants to begin?
Terry, we only have 10 minutes before we're supposed to end. How can we review 2 new cases? Why don't we discuss them next week and end early for once?
Nancy's on vacation next week and she's important to the case. We'll be okay. It's what we set on the agenda. Kathy, do you want to present the case?
Vacation? Where are you going, Nancy?
We are going to the cabin. We're spending a week there. The kids have a great time.
Oh, sounds
I
great.
wish I were on vacation next week. I'm not scheduled for another month.
Kathy, can you please start?
Sure. I saw Mrs. Lynn Hong, an 80-year-old woman who has a history of a left CVA. She was hospitalized 11 months ago.
I know this lady. I saw her during that time. Her right-sided weakness markedly improved after a 2-week stay in the rehab unit. She returned home able to perform all her ADLs, and she seemed to be just fine.
Well, apparently about 2 months ago, she became very agitated and the Hongs went to emergency. The doctor prescribed Haldol, 2 milligrams HS, to treat the agitation.
She's still not using Haldol, I hope. Why does anyone prescribe that drug with geriatric patients?
No, she's not on it any longer. The family tried it for a few days, but they realized that it made her even more agitated and they stopped it. That's when they decided she needed to see someone else. They're friendly with the Lees, who come to our clinic. Mrs. Lee convinced Mr. Hong's daughter that she should bring both of her parents in here for an evaluation. Sorry, I have to take this. Nancy, do you want to continue to present the Hongs?
Sure. I interviewed the husband, Mr. George Hong, who was accompanied by their married daughter, Susan Tan. Mr. and Mrs. Hong have 3 children, 2 daughters and a son. They all live near here. Susan is the youngest, and she lives just 2 blocks from her parents, and she's quite attached to both of them. Both the husband and the daughter are very concerned about Mrs. Hong. Mr. Hong complains that about 3 months ago, Mrs. Hong began to be forgetful. A couple of times after she was done cooking, she forgot to turn off the stove, and that really surprised them.
So then this is a sudden change in behavior?
Right. And the daughter also said that her mother frequently cries for no apparent reason and seems disinterested in everything. The daughter is constantly cleaning the house for her parents. Her father doesn't know how to cook or clean, so this is really taking its toll on the daughter. Mr. Hong, who was present during the interview, seemed to be very uncomfortable with his daughter's assessment. He denied there were any problems and kept insisting that she was fine, just only tired due to her heart.
I suspect this lady has multi-infarct dementia, and I've ordered a CAT scan and a dementia workup. I'm waiting for the results. We probably need a neuro consult as well.
Couldn't she be depressed? She's tearful, she's had a stroke, and we know that strokes are associated with depression.
This is a clear diagnosis of stroke. Why do you want to complicate it with depression?
I can assess her and see if there's any change in function.
What about the medication she's on?
Apart from the Haldol and some Chinese herb, I don't show anything.
What about aspirin? I'm sure that was ordered after the CVA.
It's not on the record.
Well, if it's not in there, let's start her on it.
Okay.
During my interview, the daughter mentioned that the Chinese herbal medicine was helping her. I wrote it down. Here it is, Huberzine A. Ever hear of it?
Oh no, not another patient self-medicating with herb stuff.
Don't you think we need to be a bit more sensitive to their cultural preferences? Maybe there's something to it.
Well, actually, Huperzine A is one of the new herbs being studied in the NIH in alternative medicine trials. It's a potent inhibitor of acetylcholine esterase, referred to as HUP-A. For centuries, it's been used in China to treat fever and inflammation, but a purifying compound has been a prescription drug for treating dementia in China for the past few years.
How am I supposed to monitor the effects of an herb I've never even heard of?
I'm sure the daughter can explain how much she's taking. I mean, maybe you can work it out with Simon what the dosage should be. Sounds pretty interesting to me.
I don't think so. I bet the side effects aren't even known.
I agree, it's crazy, but if you're going to be monitoring her anyway, you'll see if there's any abnormal clinical signs indicating toxicity.
Actually, the results of the clinical trials in China suggest that the drug has low toxicity. Part of the benefits of acetylcholine esterase, Huper-A complex, is its longer half-life. It seems to have fewer cholinergic effects like nausea, vomiting and sweating. It may prove to be better than Health Canada's drugs recently approved for Alzheimer's, but the results aren't really clear yet.
Aren't we ahead of ourselves? We need the results of the workups I've ordered, and someone needs to schedule her for a neuroconsult. Hey, I've got to get out of here. It's after 9 and I have patients waiting.
I'll figure out a plan for Mrs. Hong. Thanks. Have a nice vacation, then,
Have a good
Nancy.
vacation, Nancy.
Enjoy yourself.
Yeah, have fun.